The San Diego Beacon is known as the ER beacon because we've engaged a pre-hospital field and the paramedics and the 911 system to bring in the pre-hospital health care and the pre-hospital patients into the HIE. We actually use the 911 system to help consolidate information for patients that are HIE utilizers and have case managers that they've signed consents with to help with their care to decrease that 911 use and improve the community's dollars that are spent for those 911 and focus those resources on the much more urgent or necessary cases. We've also done in the pre-hospital field is obtaining those 12-lead EKGs. We've decreased the time that it takes for a patient to get to the cath lab that has a real heart attack, but more importantly, we've decreased all those false positives, so now patients don't have to undergo a procedure if it's not a true heart attack. And we've seen significant savings for that, both patient safety as well as for the hospitals themselves. Some of the major hurdles was actually getting them in the room and actually getting them together. Once they sat down together, you had the key people in the room that could make the decisions, that understood the complexity and the technology of exchanging information. We were then able to not necessarily have to convince them because they convinced themselves, but it's the right thing to do for the community. And that was the major hurdle, is just getting those folks into the room. Other technical hurdles, bringing systems together that are different, not too much of a hurdle, more resources than that. And we find that it's much more of a community effort that the partners actually commit to. There is a process that everyone has to go through. Every community is different. That's why there's 17 beacon communities in the country. There's 17 different ways to do the correct thing. It's all with the end goal of making the patient's health better, bringing the information to the correct provider and making it more economically feasible and not having to repeat tests or go to different physicians that are unnecessary. So if the patient consents appropriately for the health information exchange, or if they just come to, say, an emergency room or a patient, a primary care doctor, that they haven't been asked before about the health information exchange, they can authorize the provider to access the health information exchange for their information. Once they do that, the provider can actually access from Kaiser, they can get a CCD or a continuous care document that has a summary of all the visits that they've been to. If they're a VA patient, they get something that's called a C32, which is very similar